Anxiety, mood swings, depressive symptoms, low self-esteem, negative body image, eating disorders. I am not reading terms from psychological books. I am talking about polycystic ovary syndrome. PCOS has reproductive and metabolic implications, but did you know that PCOS also holds psychological consequences? Welcome to Holistic Ovaries, where we talk about polycystic ovary syndrome. Here you can learn about management, treatments, relationship, hormonal imbalances, menstrual health, emotional health, and mental health. Everything that helps you to live with PCOS better. I'm Agnese and I myself have PCOS. It has been already 5 years since I was diagnosed, and let me tell you, this journey is like a roller coaster. So that's why I'm here, because I want you to know the more information about PCOS, so you will be able to better manage your own symptoms. In previous video, I told you that PCOS is not only about reproductive system, but also about endocrine system, metabolic. I told you that PCOS affects many different bodily systems, and including your mental and psychological well-being. Why do we talk about psychological health and PCOS? Because mental health implication and psychological health in PCOS women is still overlooked by medical practitioners and is vastly ignored by general public. Why? Because you have a woman who have acne, losing her hair, have a hair growth, gaining weight, and have no period. Who would bother? But what people don't see is the infertility struggles, grief, loneliness, eating disorder, depressive symptoms, anxiety, mood swings, isolation, and in extreme cases, even suicidal thoughts. It has been reported that around 22% of women with PCOS struggle with psychological disorder. So if any of the above applies to you, please know that you are not alone. There are many of us women with PCOS who struggle with psychological and emotional health, including me. So please do not normalize the feeling of anxiety, depression, eating disorder, the maladaptive thoughts about your food, weight, or your body, because you deserve to feel good about yourself and you deserve to feel good about your life. So please, if any of this happened to you, don't be embarrassed or ashamed and look for professional help. But what influences psychological health in women with PCOS? The issue it is quite complex and the reason is not very well known, but there are some factors that influence our mental well-being, including hormonal imbalances like high level of androgens or testosterone, lack of ovulation, lack of periods, infertility issues, low vitamin D levels, higher marks of inflammation, symptoms physical that are so distressing, and the lack of support. The fact is that your symptoms will influence how you feel. I know that from my own experience. Acne, hair loss, weight gain, hair on your chin will make us feel not good about ourselves. But how you feel about yourself will influence how you think and how you act. So please show yourself compassion. And I'm not telling that now you have to love yourself, you love your PCOS, love your symptoms, and all of a sudden you will feel beautiful, full of energy, and healthy. It will be just damaging. Accept your feelings, acknowledge them, and because your symptoms are valid and your feelings are valid. So accept your current situation and accept that you have PCOS. PCOS narrative is surrounded by fear and worry. What will happen in the future with my health? Will I be able to have children? Will I have a diabetes? So much worry. But that kind of thoughts and feelings doesn't help you, because in reality is that you don't know what the future will bring. I don't know, not even your doctor know. So try to think positive. I know it sounds so weird. How can you think positive? But try to focus on things that you can do today that will make your future better instead of worrying, because feelings of anxiety and depression will only stop you from acting and bringing implementation of health management for PCOS. Treatments for PCOS are heavily based on lifestyle modification like diet, exercise, and weight management. I am sure you heard this famous phrase, eat less and exercise more, right? But remember that lifestyle modifications are not only about dieting or exercise. They include your psychological well-being, your emotion, your cognitive strength, and also your social interactions. Emotional dysregulation, maladaptive thoughts, limited core beliefs, and your daily habits can prevent you from implementing lifestyle changes, and ultimately they can stop you from achieving your PCOS health and management goals. Research suggests that psychological treatments should be integral part of PCOS management. Um, International guidelines for PCOS management include lifestyle counseling. Unfortunately, for now, awareness about psychological treatments for PCOS is still behind and it's still ignored. That's why it is so important that you yourself, additionally to monitoring your physical symptoms, you also monitor your psychological symptoms. I know that it is not easy to live with PCOS, but strong mind and strong attitude will help you to cope better with your PCOS. This video is also a call for medical practitioners. Please remember that we women with PCOS, we also, additionally to physical symptoms, suffer with psychological and mental health. So please treat us with kindness, because you never know with who you are working with. Your psychologist or therapist, please take in consideration the hormonal imbalances, menstrual health, and PCOS emotional struggles, because this will help you to treat your patients better. Let's all remember about our mental health. That is so important for our quality of life. So tell me, how is your mental health? Do you struggle mentally and emotionally with your PCOS symptoms? Please leave me a comment, subscribe, ask questions, share the video with other women with PCOS, and remember about taking care of your mental health. One of you asked me to talk about hirsutism, so in next video, that's what we're gonna talk. So if you yourself struggle with hirsutism, please stay tuned. I will see you next video. I hope that you enjoyed, and see you soon.